to Adapt English. Today, we are breaking down one of the most tested neuro topics on the NCLEX or NCLEX school. This is the Glasgow Coma Scale, GCS. By the end of the video, you know the category, how to calculate, and how to use them in the question using mnemonic in a logical way. Are you ready? Let's get to it. First, information you need to know is what is GCS. It's used to assess client's level of consciousness. What does that mean? It means any patient with a head injury, any patient with a stroke, any patient with trauma, their level of consciousness is affected. And therefore, in order to know their level of consciousness, use the 3 A's. That's the first mnemonic. Write it down. What is the 3 A's? The alertness, the awakeness, and whether they are aware of their surrounding. This is what we are testing when we come to GCS. First thing, you have to know what the component of the GCS. It evaluates 3 things, like the triple A's that I talk about, and therefore the 3 categories. The second mnemonic I want you to write down is what? EVM. Heavy variable move. If the thing is variable, it's going to move. Therefore, EVM. And that is the 3 categories the GCS is testing and assessing. The first one is eye movement. So your eyes is the E. The second one is what? The verbal. That's the V. Verbal is the V. And then the modal is the M. Modal function. What does that mean? How does this constitute with the calculation of the GCS? Look, each of them is assessing certain information, very important to your brain. The E is assessing your brainstem and alertness because it connects to your eyes. The V is talking about your orientation and communication. You will be able to communicate, but sometimes you cannot follow command. And that is where the M comes in. The M is the modal function, assessing whether you can follow command appropriately. Even though you may be oriented and you can communicate, you won't be able to follow command. And this is why each of this is very important in assessing your alertness. Now, the E, which we talk about every variable move, the E, how much does it contribute to the GCS? It's the same as the spelling of the E. There's 4 letters in it. E-Y-E-S, 4. So this is how you can remember which one give you a total of 4. That's the E. The V, I use voice because voice give you 5 letters instead of the verbal. So the V is the same thing. Your voice, what is coming out with your speech, 5 letters. The M, it has 6 letters. So the acronym for that is what? Old band. So old band has 6 letters. And we're going to see how these 6 letters contribute to the total calculation of the GCS. These are concepts. It's very important in understanding GCS calculation. So remember that. Write it down. Repeat it to yourself. E is 4. Voice, which is V, is 5, and M is 6, which is old band. Therefore, you have to understand nobody is going to have GCS of 0, because if you don't do anything at all, you're going to get E1. If you don't do anything at all, you're going to get V1 and M1. So the lowest GCS you can get is 3, and the maximum is 5 based on adding 4 plus 5 and 6. So E of 4, V of 5, M of 6, and the lowest is 3 and the maximum of 15. Now let's take each one of them. But before that, let's see what does the number indicate. There's a severity associated with the brain injury. If your GCS is between 13 and 15, it's a mild injury. If it's 9 to 12, it's a moderate. If it's 3 to 8, it's very, very severe. That means very severe. Your E and V and M are very low numbers. If the total is 8 and less, that means we got to protect your airway. And this is why you've heard this before, that anybody with the GCS of 8 and less, it need to be intubated. And because you cannot protect your airway, your consciousness is too low to protect your airway. Remember, there's some patients who already had a tracheostomy or they already intubated. You cannot assess their GCS in terms of verbal. So the verbal, they can only get the maximum they can get is 1. So most of the time you will see a V cannot assess, or you give them 1, or you give them T. So if you see 9T, it means the patient is intubated or has tracheostomy, and I cannot assess their total verbal response. So watch for that when you see 90 or you see T or V in the GCS, it means I cannot assess their verbal response. These are concepts I want you to know. And then that will make GCS easy. When you see a question, it's easy to calculate. Now, we are going to tackle each one of them. What is E? E, the total is 4. There is a mnemonic how to calculate it. The maximum you can get is 4, which is spontaneous. That means you open your eyes spontaneously. Your eyes is already open. I don't need to say anything to you. If I make a sound before you open your eyes, you get 3. That is sound, speech. If I pinch you, I touch you, and I apply some pressure before you open your eyes, you get 2. If no matter what I do, if I talk to you, if I pinch you and you don't do anything, you get 1. How do you remember? The mnemonic for this is that no pain sound good. Why? No is the last one, none. Pain, if I pinch you before you open your eyes, is 2. And then sound is 3. And then spontaneous means it's good. Therefore, mnemonic to remember, eyes movement regarding GCS is what? No pain, sound good. No pain, sound good. This is an example. A client opens their eyes only when you apply nail bed pressure. That is pain. And the mnemonic say no pain. So pain is 2. No is 1. Sound is 3. Good is 4. Therefore, this patient get E2. Same thing. We are going to the verbal. The verbal response is 5 total, right? If I'm talking to you, you are alert, oriented, you know what you are, you know what your name, the place and time, AO times 3 or 4, you are oriented. If you confuse, you mix one of them, you get 4. That is disorientation. You can talk and communicate, by your communication, you confuse about certain things. If the words that coming out is what? Random, is inappropriate, right? It doesn't make sense completely. It's a random response to words. You get 3. That is inappropriate. It's different from incomprehensible. Incomprehensible means it doesn't make sense at all. I cannot even understand what you're saying. You're mourning. You may not making a good sound. Mourning and groaning is incomprehensible. I don't know what you're saying, but you're making a sound. It's different from making the words that are random. Therefore, incomprehensible, you get 2. If there's no verbal response, you get 1. How do you remember this? This is the way you go. Start from the body. No verbal response. Incomprehensible means you mourning. Inappropriate means random. Confused, disoriented. Oriented is the last one, number 5. Therefore, no mourning, random, confused words. You cannot mourn random, confused words with the no as 1 and words are 5. This is the easy way to remember. Using this mnemonic, whenever they give you a question and you want to calculate the verbal, say no mourning, random, confused words. And this is the example. The client says random, and then you tell yourself, no mourning, random. Random is 3, V3, like car blue Sunday. Car blue Sunday is a random word. They don't connect to each other. Then you know that this patient has a verbal of 3 in terms of GCS. And the last one is the motor function. That is the most important one. You get 6 total. If you obey a command, you do everything I tell you, you get 6. If you localize to pain, that means I pinch you and you look at the area the pain is coming from, that means localization. If you look at where the injury is coming from, where the trauma is coming from, is localization. When you pull away from where the trauma is coming from, is drawing away from the pain, you get 4. If you bend towards that, bend abnormally, flexion, which is decortication, you get 3. But when you extend, you get 2. If you don't have any response at all, is 1. What is the easy way to remember this? I call it old bend. With the O, no, obey command. L, you localize. D, you draw. B, you bend. E, you extend. And the N, no response. A total of 6. Patient localized, then you say, oh, O-L, L, 5. I get 5 when you push it away from the nest, M5. This is the easy way to know GCS and calculate. Old bend is the model function mnemonic to calculate GCS. Now, let's recap and use these NCLEX steps, because NCLEX steps are very important when you see a question. What do you see? Always assess the patient best response. Pick the best they can do, not the partial one. And then you have to assess the GCS frequently, because it can change. Any change, when it starts going down, is a problem. That means ICP is issue. It's an issue. If it's going up, it's good. The motor function is the most important. So if you want to see if the patient is doing well, their eyes can be closed, but if they following command, it's better. So motor function is the most important. If they're extending, all of the sudden they're flexing, that is good. And they start localizing, it's a good information that their brain is recovering. So motor function is the most important. Now, let's try some questions. A client responds to pain by what? Flexing, that is motor. Use old bend. When you flex, you bend, right? Arm towards the chest. What is the motor function? Use the old bend mechanism. Put down your answer in the comment and type hashtag GCS mastered and put your answer down, and let's take a look at it. A client responds to flexion towards the chest. What is the motor score? You can know that this is old bend. Using old bend, this is M3. Number 2, a client opening their eyes to speech, right? You're going to use the eyes example, right? Is confused, right? In conversation, right? That's verbal, right? Then localize using old bend. If you write old bend, you know localizing is the higher, they can get a higher score, but less than 6, right? And if you open the eyes to speech, not spontaneously, it has to go down 1 point, right? And then the confusing conversation, talking but not following command, right? It's no alert oriented times 3. You see how everything came together. What is your score? Once again, type hashtag GCS mastered and put down your score for this client who can open their eyes to speech, is confused in conversation, and localize pain. The right answer is this. E3, because they open their eyes to speech, they're confused, they get 4, they can't get 5, and they localize instead of following command, they can't get 6, so they get 5. In total, GCS of 12, this is a little bit, not that great, but it's a moderate brain injury. You have to see this patient. What do you think? Thank you for watching. Thank you for subscribing to Adapt NCLEX. If this video helped you, put down in your comment and say GCS mastered. And if you need more content like that, subscribe to Adapt NCLEX for more content. Take care of yourself and good luck in nursing school and the NCLEX. Bye.